cancer, unfortunately, has become the leading cause of death in our community, in the state of Massachusetts and across the country.
We're excited to announce that BHO, their physicians and their staff, will be joining with Berkshire Medical Center and Berkshire Health Systems to build a comprehensive state-of-the-art cancer program and facility.
This partnership between BHO and BHS will continue to improve the level of care that patients receive in Berkshire County in both hematologic and oncologic problems.
I definitely view this new cancer center as a once-in-a-lifetime opportunity. This is the melding of two very strong partners who are going to be working together for the first time.
I'm very excited about the new cancer center, and I think for my patients it'll be an opportunity to have care delivered in a brand new facility. From the point of view of the physicians and the health system, it's an opportunity to work together to produce a new way of doing things.
We are very fortunate to have the relationship we now enjoy with the physicians at BHO. When you talk about developing this comprehensive cancer center, which we're happy to be able to announce, it just wouldn't have been possible without them and their cooperation. You know, they have been providing services to our community for decades and done it extremely well. We could have never gotten here without them and their support, and we're grateful for it.
The financial piece of this, in this current healthcare world, is to have a strong financial partner to allow us to always be advocating for our patients and their health care. And we're fortunate that the health system provides that to Berkshire Hematology Oncology.
Luckily, BHO and Berkshire Health Systems could come together to develop this program. And I think that given the pressures on private practice, the pressures from reimbursement providers, and pressures on the necessity to provide cancer care to our patients, we have come up with a perfect solution to provide what I think will be not only just a modern facility, but a cutting-edge cancer program.
It'll be a state-of-the-art center. There's nowhere you're going to be able to go and walk into a center that'll be more comprehensive than this one. We hired Canon Architects. They are experienced in building these centers, and they've built many of them. They have worked with us to develop something that works back from the needs of our patients and their families and is designed around them and their needs. So I don't think you could go anywhere and find a facility more welcoming or better designed to meet the needs of you and your family. And we're proud of that.
Canon Design was challenged with not just developing a building, but changing the way cancer care is delivered. Our approach to this was really an evidence-based design approach, which included knowledge gained from dozens of facilities that we've recently completed over the past few years, and also included input from hundreds of patients, families, and their caregivers with whom we've worked with over the years. We then use this as a starting point to partner with Berkshire Health Systems and work closely with their clinical teams to design not just a building, but the patient experience, the family experience, and the staff experience.
The administration here has done a fantastic job at coming up with the resources to do such a big endeavor as this, as building a cancer center in Berkshire County.
I think one of the things that excites me is thinking through the patient's perspective of walking into a building, sitting in the waiting room, and just having these beautiful surroundings. Coming to an oncology visit carries a degree of anxiety with it for a lot of patients, and to be able to come into a surrounding like that, that's soothing, that's relaxing, really seems small, but makes a big difference in the experience of the cancer patient.
Having this cancer center in Berkshire County is an incredible innovation because it'll be the first time we have all of the players under the same roof. So we have oncology, we have surgery, we have radiation oncology, we have radiology, and I think it will just be fabulous.
One of the benefits that people will enjoy immediately is we'll have better access to physicians. Whether you live in Williamstown or Great Barrington, our ability to recruit has enhanced our ability to offer access to physicians.
Coming out of a prestigious academic fellowship, I had opportunities to go a lot of places. I ultimately chose Berkshire Health Systems for the opportunity to come back to Berkshire County. Berkshire County is my home county. It's where I grew up. I love it here, and the opportunity to come back and care for patients in this community means a lot to me.
The Cancer Center is going to enable us to really work together more cohesively as a team, to enable better collaboration, even than what we already have, ultimately with the goal of making better treatment plans for patients. And that's really what this is all about, optimizing patient care, and so that's our goal.
Well, I think the new Cancer Center certainly is going to allow us to interact more closely and have more of a closer collaboration, which is very unique in today's era, because cancer surgery or cancer care is usually multidisciplinary. It involves the expertise of multiple subspecialists to deliver the most comprehensive treatment planning. And so the Cancer Center will allow us to deliver this type of treatment in this community.
Quality accrediting bodies believe that cancer care in the Berkshires is already outstanding. The integration of superb physician care with care navigation, with social services and other key services for our patients will lead to a dramatic improvement in both survival for our cancer patients and a marked improvement in their quality of life.
The new Cancer Center will improve the patient's experience by allowing the nurse navigator to become a more effective advocate for the patient. We will be able to participate in multidisciplinary visits along with the patients so that we're able to immediately answer questions that they might have following these different appointments.
I think complementary treatments are very important in cancer care. You know, I've seen it both in my patients and in my own experience with cancer. I'm a leukemia survivor, and things like meditation, things like Reiki, yoga, those were really important to me as I went through care and really important to a lot of patients.
This is about having the potential for radiation oncology and medical oncology to be situated in the same location for patients to be able to access the subspecialties of oncology without having to travel and without having to do anything other than centralize their care at one large, highly skilled, very specialized cancer center. And it's going to be a very exciting time for the cancer patients in Berkshire County.
This is an exciting time for everyone, certainly for us at BHO. It's a perfect time to partner. Berkshire Health Systems is a wonderful, dynamic group to partner with. They have superb leadership with David Phelps and Darlene Rodowitz. They're honest, intelligent, aggressive people who have been just a pleasure to deal with.
I'd like to express our gratitude to the physicians and staff at BHO. In particular, we're grateful to Drs. DeLeo, Zimbler, and Rosenthal for the commitment they've shown and all the work and time and effort they put into this project. We'll always be grateful to them for what they do to meet the needs of our patients today and their commitment to the future of high-quality cancer care here in the Berkshires. At the same time, we'd like to thank the physicians at Berkshire Medical Center and the staff at Berkshire Medical Center who have participated in the project. It is clear that everybody's committed and pulling in the same direction. We all have the same vision for this program and facility, and I think people are going to be very, very happy when this comes to fruition and they see what it means, both for those who are diagnosed with cancer and the loved ones who share the experience with them, and the physicians and staff who work meeting their needs. We're excited about this, and thanks to all of you.
This will be an icon that will be a symbol for everyone in the county.
I believe that this new integrated cancer center will have a profound impact on cancer survival rates and quality of life for patients with cancer.
The opportunity to build a cancer center in our community is what I've been waiting for all throughout my career.
Berkshire County is my home county. It's where I grew up. I love it here, and the opportunity to come back and care for patients means a lot to me.
The new Cancer Center will definitely improve patient care.
I can't even put it into words how excited I am about this opportunity.
This new center will make their journey easier.
This is all about the patients.